program is about equipment and moving your patient. After completing this lesson, you will be able to explain 2 precautions in using the Hoyer lifter, identify the steps in transferring a patient to a wheelchair, and describe 3 points which apply to the use of the walker.
Welcome back to our program on moving your patient. Our goal is to ensure that your job is rewarding, safe, pleasurable, and definitely not backbreaking. Today we'll show you more about safety and the use of equipment. Before we begin, however, let's take a moment to review some of the important points we discussed in the first part of this program. We learned that good posture and the use of good body mechanics are essential to the good health of your back and the safety and comfort of the patient. Good posture means that all of the natural curves of the spinal cord are aligned. If you put a plumb line to the side of your body, your ears, shoulders, hips, knees, and ankles should be aligned. Body mechanics refers to the way we move and use our body. Good body mechanics ensures that all the parts will move in an effective and careful manner. These are the important concepts in good body mechanics. Stand erect and maintain good posture. Always have a broad base of support. Keep your feet 12 inches apart. Kneel or squat instead of bending at the waist. Use the stronger muscles of your shoulders, upper arms, and thighs to do the work, not the back muscles. Stay close to the patient, providing support, preventing falls, and minimizing the strain on your back. We also had the chance to see these principles applied as we learned how to help the patient ambulate and reposition. Let's review the important guidelines for moving your patients. Follow the assignment on your care plan. You must understand exactly what your duties are. Know your patient's level of activity and any weight-bearing limitations or other restrictions. Assist and encourage your patient to participate in care planning and delivery. A good explanation will ensure patient cooperation and participation. Modify your care delivery to meet your patient's specific needs. Put safety first. Have adequate lighting and clear pathways. Remove any obstacles to ambulation. Encourage the patient to wear sturdy, safe shoes. Give the patient time to adjust to a change in position. Monitor his or her condition as they transfer or move. Now, how does your back feel? Hopefully, you learned important points that you were able to apply in care delivery. If your back aches, maybe you should go back and review them. In this program, we'll focus on body mechanics and use of equipment to assist in moving your patient. We'll again learn from Tom and his caregiver, Judy. Since we last visited them, Tom had a severe case of the flu, which developed into pneumonia. That, combined with his arthritis, left him in a very weakened state, unable to move independently or participate in care delivery. After being discharged from the hospital, Judy used the Hoyer lifter to transfer Tom. As he recuperated and regained strength, he was able to use a walker and wheelchair. We'll track his recovery and learn important principles that you can apply to your patients. We'll again watch Tom and Judy demonstrate as we present the step-by-step instructions. Let's start with the Hoyer lifter, more commonly called the Hoyer lift. The Hoyer lifter is a mechanical lift which allows a person to be lifted and transferred safely with a minimum of physical effort. A medical equipment company will provide the Hoyer lifter to the patient. Their consultants will assist you and the patient in selecting the most appropriate style of lift. The equipment must be both practical and comfortable, serving the needs, comfort, and safety of the patient. At least once a month, the lift should be inspected by a person qualified to check freedom of pump operation and ease of base adjustment, and to recognize any signs of wear or looseness of bolts. You should be familiar with the Hoyer lifter you'll be using. Let's describe the parts of the lift. The lift rests on a base. The most common form of base is the adjustable U-base. The handle lever allows you to adjust the space between the wheels so the lift can fit under the bed or around the chair. The base legs should be spread to the widest possible position when lifting someone to maintain stability. The base of the lift has wheels. 2 of the wheels have caster brakes for safety. To lock the casters, step on the cam lever on the side of the caster. To unlock, step on the highest cam lever. You should lock the brakes when transferring the patient. If it's necessary to move the lift during the transfer, release the caster brakes, carefully move the lift, and lock the brakes before lowering the patient. The hydraulic pump enables you to move the patient up and down. The pump handle is equipped with a pressure release knob located near the base of the handle. By turning the release knob, pressure is either released or contained, allowing the lifter boom to be raised or lowered. The boom is the part of the lift which moves up and down. Always be sure that the boom will not interfere with the patient or your assistant when operating the lifter. The swivel bar attached to the boom holds chains which are detachable. The end of the chains have S-hooks which attach into the sling. The sling serves as the seat for the patient during the lift. There are many designs for slings to meet the need of different patients. Some have openings which facilitate toileting. The sling has 2 metal bars in each side to maintain stability of the sling during the transfer. You can launder the sling after removing the metal bars in warm or cold water in the washing machine. Don't use bleach or wash the sling with colored items. The Hoyer lifter is a valuable aid to patient mobility. However, only individuals who have had proper instruction, demonstration, and practice should use the lift in actual patient care. You receive this training as part of your basic instruction and orientation. Practice will enable you to transfer the patient smoothly, so the patient does not bounce around or hang suspended in midair. It is also a good idea for you to experience a transfer in the Hoyer lifter. Assume the role of your patient and have a coworker transfer you. That way you'll know what it's like for your patient. In operating the lift, follow these precautions. The Hoyer lifter is a transfer device. Use care, discretion, and common sense when transferring patients. The lift should not be used to transport anyone. The lift may not be the way to move all patients. The manufacturer's instructions state the maximum weight which can be lifted safely is 400 pounds. However, if your patient is very obese, regardless of the weight, or if you have any concerns, check with your supervisor. Patients who are spastic or severely handicapped require extreme caution if they are transferred with the Hoyer lifter. We recommend that you seek instruction and guidance. Do not attempt to lift any patient who does not approve of the transfer or who will not cooperate. If the patient begins to panic during the transfer, immediately reverse the procedure and return the patient to bed. Never leave the patient unattended once you have started the transfer. If possible, don't use the lift alone. It's best to have someone available to assist you with the procedure. The person assisting, if not experienced in the use of the lift, should do only as instructed by you. It takes some organization and planning to successfully transfer your patient. Before beginning the transfer, be sure that you have reviewed the care plan and know your patient's abilities and limitations. Carefully plan the transfer before beginning. Determine the path the lifter must take to transfer the patient safely and successfully into a chair. You may have to remove some furniture or temporarily rearrange the bedroom. Arrange all items before you begin. Be sure that the wheelchair, with brakes locked, chair, or commode is available. Have the sling ready. You don't want to leave the patient alone to get an item after you have started the transfer. The patient should be positioned in the center of the bed. If the bed has side rails, raise the side rail on the opposite side of the bed from where you're working. Judy has the necessary equipment ready and has explained the procedure to Tom. The lift is in place with the open end of the base under the bed. Judy also checked that each chain was firmly attached to the swivel bar. Here's the procedure for a transfer with the Hoyer lifter. To position the sling, fold it in half lengthwise. Roll the patient away from you and place the folded sling halfway under the patient, similar to positioning a draw sheet. Turn the patient toward you to pull the sling through entirely. It'll take some practice to get the position correct. The lower edge should reach to the patient's knees, the upper edge to the patient's shoulders. Attach the S-hooks of the chains into the openings on the sling. The open end of the S-hook should face away from the patient, to the outside of the sling, and go all the way through the opening. Encourage the patient to cross his arms over his chest. Now you're ready to lift the patient. Be sure that the caster brakes are on and the hydraulic release knob is closed. Turn the knob clockwise to close. Pump the hydraulic handle. Hold the steering handle with your other hand to steady the pumping action. Use a slow, steady, strong pumping motion. Make any adjustments necessary for the patient's comfort. Some patients may need support for their heads during the lift. Watch the patient's reactions. His comfort and safety are your primary concerns. You'll probably notice that you'll exert more effort in pumping as you raise him further off the bed. When the patient just clears the bed, swing his feet off. Don't raise the patient higher than is needed. Grasp the steering handles and turn the lift toward the chair. Keep the patient centered between the legs of the lift. Let's stop for just a moment to reiterate some points about good body mechanics. As you work with the Hoyer lifter, maintain a wide base of support with your knees flexible. Keep your body positioned close to the lift. Shift your body weight for leverage to help move the lift. Watch Judy follow these principles as she moves Tom into the chair. Position the lift over the wheelchair, rolling the legs around the wheelchair. Lock the caster brakes. To lower the patient into the chair, open the hydraulic release knob by turning it counterclockwise, no more than one full turn. Use one hand to open the knob, the other to ensure that the patient's position is correct as you guide his descent. After the patient reaches the seat, push down on the boom to slacken the chains. Detach the S-hooks to remove the chains from the sling. The patient can remain sitting on the sling. To return the patient to bed, reverse the procedure. Reattach the chains to the sling. Tighten the hydraulic valve and begin pumping slowly. Be careful that the S-hooks don't catch the arms of the wheelchair as you raise the patient. Turn the lift over the bed. Release the hydraulic valve and carefully lower the patient to the bed, making sure that the patient is centered on the mattress. Remove the sling. Put away the lift and tend to the patient's comfort needs. After the transfer, document the procedure and any important observations. Be sure to contact your nursing supervisor if you have any concerns about the use of the Hoyer lifter in care delivery. It's time to check your knowledge. Can you name 3 types of patients who may not be appropriate candidates for transfers using a lift? What are 3 precautions to observe when using the Hoyer lifter? Can you list the steps in the procedure for transferring a patient with the lift? The Hoyer lifter is a piece of equipment which you'll use for patients who cannot assist with the transfer. This was the case for Tom when he was extremely weak. Now he's on the road to recovery and is able to assist Judy in transferring. Tom uses 2 mobility aids, the wheelchair and walker. We'll learn more about the wheelchair as we watch and listen. Tom has had lunch, been visited by the physical therapist, and had a short afternoon rest. He has a doctor's appointment, so Judy will help him transfer into the wheelchair. Tom is fully dressed. However, if your patient is in nightclothes, use a robe or blanket for warmth and covering while he's sitting up in the chair. The wheelchair is a very valuable means of transportation for many people, but again, there are some precautions. Remove or fold the leg and footrests out of the way during the transfer. This will prevent the chance that your patient will bump his legs or feet. Always remember to lock the brakes when transferring the patient in and out of the chair, or if the patient will be sitting in one place for an extended period of time. Position the wheelchair so that the transfer is done from the patient's stronger side. For example, if your patient has right-sided paralysis, position the wheelchair closest to the patient's left side. This will maintain safety while promoting the patient's assistance. Check that all clothing, any catheters or tubings, and the patient's hands and fingers are clear of the wheels before moving the chair. Don't let the patient drag his feet on the ground. Practice wheeling the wheelchair on unlevel surfaces or over curbs before you work with the patient in a similar situation. Be sure that the wheelchair receives regular maintenance and cleaning. This will ensure that all parts are working correctly and safely, and that there are no unpleasant odors. Let's observe the transfer of Tom into the wheelchair. Be sure that there is enough room available to perform the transfer procedure. You may need to move some furniture out of the way. Explain the procedure to your patient. Fan fold the bed covers to the foot of the bed. Remove pillows to allow free movement. Your patient should wear shoes or slippers with gripper soles so they will not slip when transferring. Lock the brakes and remove or fold the footrest so the patient will not be injured. When the patient is lying in bed, there are two distinct parts to the procedure of transferring him into the wheelchair. First, help him to sit up, and then help him to transfer to the wheelchair. There are several ways to get the patient into a sitting position, depending on his abilities and level of participation. If the patient has an adjustable bed, it would be most efficient to raise the head of the bed until the patient is sitting up. You would then simply slide his legs over the edge. Tom and Judy will use another approach that works well. Help the patient turn on his side facing you by flexing his knees and rolling him towards you. Place one arm under the patient's neck, reaching to grasp the far shoulder, and place the other hand under and around his legs. With your knees flexed, lift the patient's shoulders and guide his legs off the bed, bringing his body to an upright position. Stand close to the patient to make sure that he doesn't slide off the bed or lose his balance. Now that Tom is sitting on the side of the bed, Judy will assist his transfer into the wheelchair. This involves helping him to stand up, turn, and then sit down in the wheelchair. You will use a transfer technique many times during care delivery to assist patients from chair to bed, toilet to wheelchair, or wheelchair to car. The stand pivot transfer method is comfortable, safe, and most commonly used to move patients from one place to another. And of course, the more weight bearing your patient can do, the easier the transfer is to accomplish. Be sure to check your care plan for any modifications. Judy will assist Tom to complete the transfer into the wheelchair. The technique is to place your arms around the patient, grasping the patient's belt or gait belt. Bend your knees against the patient's knees and place your feet in front of his to provide support and prevent slipping. On the count of 3, straighten your legs as you boost the patient to a standing position. Continue to support the patient as you both take small steps, pivoting sideways until the back of the patient's legs touch the seat of the wheelchair. Have the patient grasp the far armrest and then move a bit further so he can grasp the other armrest. Ease the patient into the chair. Be sure to bend only at your knees and hips, not your back. Adjust the leg and footrest of the wheelchair and tend to any comfort needs. Document the procedure and any important observations. To transfer the patient from the chair back to bed, you would reverse the process. As you practice transfers, you'll develop your own technique, which you will be able to modify to fit each patient's individual situation. Some patients with limited weight bearing may not be able to take any steps and will pivot on one foot. In those instances, you will do more work. Position the wheelchair closer to the bed and the patient's stronger side. And remember good body mechanics. For other patients who have more strength and ability, you will only give them a boost to get up and minimal support during the transfer. Know what your patient can do. Follow the care plan and discuss any concerns with your nursing supervisor. The second mobility aid Tom uses is a walker. Many of your patients will use mobility or ambulatory aids such as canes, crutches, or walkers. The type of ambulatory aid used by the patient is selected by the doctor and is dependent on the patient's particular health problem, weight-bearing limitations, and disability. If the patient is non-weight bearing, this means that no weight can be placed on the affected limb or foot. This type of patient will probably use crutches, placing all the weight on the arms and uninvolved leg. Partial weight bearing means that minimal weight can be placed on the toes or forefoot. A patient can use crutches, but most often a walker works better. In full weight bearing, full weight is placed on both legs. This patient uses a cane, primarily for balance, but not for weight bearing. A physical therapist or nurse will teach the patient how to use the ambulatory aid properly, but many patients cannot manage them independently. How many times have you seen a patient carrying the walker instead of using it for support? You will be the one to guide your patient or to stand by, ready to give assistance. Tom is using a walker, as do many of your patients. A walker provides maximum support to help the patient maintain stability and balance during ambulation. A walker is very helpful for individuals who are weak, experience balance or coordination problems, or are overweight. Many elderly people use a walker to increase their stability and minimize the fear of falling. As with any assistive device, there are some general guidelines and precautions you must observe. To serve its purpose, the walker must be the right height for the patient. To check the height of the walker, have the patient stand inside the walker with his hands outside. The hand grip should be level with the crease in the patient's wrist. Many walkers can be adjusted. You may need to get assistance from the physical therapist or nurse to adjust it properly. The patient should wear proper footwear. Be sure that all obstacles to safe ambulation are removed. Provide support and encouragement, but don't rush or distract the patient. Encourage him to move slowly. A patient should use the walker on a flat surface with proper lighting. We don't recommend use of a walker to go up and down stairs. And like any equipment, the walker needs periodic checks to be sure that it will not pose a hazard for your patient. When you assist your patient with the walker, you should know which gait, that is, pattern of steps and weight bearing, that your patient should use. Several gaits are possible, depending on the patient's problem. The type of gait is usually ordered by the doctor and taught to the patient by a physical therapist. Because Tom is weak and has no weight-bearing limitations, he follows a normal pattern of walking. It's time for Tom's rest period, so Judy will assist Tom to walk to bed using the walker. To do this, place the walker directly in front of the patient so the patient can comfortably reach the hand grips without overextending. Have the patient push on the arms of the chair to move himself to a standing position. Continue to support the patient until he has a firm hold on the hand grips of the walker with his feet firmly planted. Give him a minute to gain his balance. To walk with the walker, the patient should pick it up, reach it out to advance it 8 to 10 inches, and place it firmly on the ground. The patient should use his arms, elbows, and shoulders to advance the walker and not lean forward with his body. Then the patient steps into the walker with one leg, followed by the other leg. If the patient has a weak or injured leg, he should advance that leg first, transferring weight onto the hand grips. This helps him to keep his balance and protect the injured leg. Encourage the patient to take his normal steps. Walk slightly behind him, ready to provide assistance or support. Remind the patient to stand tall and look straight ahead as he walks. Assist the patient to turn with the walker and back up to the bed until his legs touch the bed. If necessary, support the patient as he sits down. Check on the comfort of your patient. Document use of the walker, distance ambulated, how the patient tolerated the ambulation, and other important observations. Be sure to contact your nursing supervisor if the patient shows any signs of intolerance or experiences any unusual symptoms. There are many important principles and precautions which apply to the use of the walker and wheelchair. Do you remember them? What are 2 important precautions to remember when using a wheelchair? What are the 2 main parts of transferring a patient to the wheelchair? Can you list the steps in each part of the transfer? What types of patients would use a walker? What are 2 precautions which apply to the walker? And can you describe how the patient should advance the walker? In these 2 programs on moving your patients, we've certainly used our time wisely. That's because we've encountered techniques which we should all be using in our everyday lives, not just while we're on the job. Yes, the skills you've learned will benefit your patient, but only if you can react quickly and smoothly, not having to stop and think about the right way to do something. Bending, lifting, and moving correctly must become habits, and only you can make that happen through daily practice in your everyday life, as well as on the job. Then you'll be able to move and transfer patients safely and effectively without ever having to think about it. With practice, it will become second nature to you, and both you and your patients will benefit. By applying the principles of using equipment, moving patients, good posture, and body mechanics, your job will be easier, and your back will stay healthy.